Adam Craig, who's going to tell us a little bit about the operations research and citizen science work from PacMOSSI, which he leads for us. Thank you, Adam.
Thanks, Amanda. Hi, everyone. Nice to see you all. Do you want to share my slides? Whoever's driving slides, thanks. So I'm Adam Craig. I've met most people and lovely to see you again. So I work at the University of Queensland as an implementation scientist in a team called the Operational Research and Decision Support for Infectious Diseases. So we look broadly across infectious diseases, largely in the Pacific, but extending out from there too. So today I wanted to just touch base quickly on what we've done in the past and the transition from PacMOSSI version 1 into PacMOSSI version 2 and how the program will evolve and then what opportunities there are for countries and their partners, so countries and their technical partners, to get involved in the operational research and community engagement side of things. Next slide, please. Click it through. Thanks. Excuse me. So PacMOSSI version 1, or what's just now finished, had two very distinct programs. One around citizen science with the clear aim of testing this approach as a new surveillance model in the Pacific. So it was very much around testing citizen science as a concept. And then operational research with the idea that countries would have an opportunity to identify and respond in a sciencey methods-based way to the operational challenges faced. And that produced some good outcomes, but feedback from countries and the experience of PacMOSSI 1 was that sure, citizen science is a good tool and it's got some value, but really community engagement and community involvement in surveillance is where people were interested in, and obviously that aligns with the global vector control strategy too. So a shift from this focus on one particular method to what works in a context will be seen in V2. And in OR, around the operational research was very much around supporting ministries of health do the work. There was a clear message that operational research doesn't need to necessarily be done by the ministry folk. It can be done in partnership with other people. So a shift from this idea of ministry-driven work to options for more flexibility in the field. Next slide, please. So just quickly, the vector control strategy, response strategy of TDR and WHO has these 4 pillars and community mobilizations clearly in there. Next slide. So in PacMOSSI V1 under the operational research program, there was these 7 projects which were funded through PacMOSSI, and most of those have finished now, and some are in their tail end. I won't go through them all, but they were very diverse and they were identified by the different country offices. Just click, please, Sal. And the recipients, sorry, it's off the field, but the recipients of these grants are listed on the bottom, or their logos are on the bottom there. I hope I got everybody. This is a combination of individual country work and then some multi-country work. So the comparison of mosquito sampling methods was an example of the multi-country. Next slide, please. And just keep going through. Thanks, Sal. So we just heard about the baseline mosquito survey. So that's a new initiative in V2. And then this idea that OR can still be conducted, but it might look like a country-driven response to a call for funding, which will happen later this year, or it might come through more organic means. So I guess that's the first call. If you're interested in doing operational research and responding to challenges you face, don't feel shy to reach out to Tessa or Amanda or myself, and we can talk about opportunities, funding, what's required, technical assistance, whatever that may be, a much more organic approach to the implementation of operational research in the coming years. Next slide, please. Regarding the citizen science program in V1, it was implemented in 3 different countries, so Kiribati, Fiji, and the Solomons, and each country took a very different approach, which was awesome to see. So the Sols looked at embedding citizen science as a project within their master's program, their environmental health training program at the university, where students went out on their field placements and worked with community groups to educate the public about mosquitoes and mosquito surveillance and get them involved in the process. That model worked really well, and it has been sustained and is now working in 17 countries, so 17 schools across the Solomons, so not just the capital. A nice model which has been written up and published in, I think, 2 publications now. Fiji worked with an NGO and engaged people. Rama, if you're online, you can correct me if I'm wrong, but work with people who live in social housing as their tool for engaging community members. And then in Kiribati, there was a pilot project done on Tarawa, which involved volunteers from the public, but subsequently that model has been used for field trips to outlying islands as a quick way to collect broad population, geographically wide specimens. So when the field team are out, for 3 days on an island, they're able to collect specimens from across a wide variety by just working with the public. This nice photo from Sols is the students preparing rearing their eggs, just like the photo. Chuck it in there. Next one, please. So I've sort of been through this already. There's a shift in PacMOSSI V2 around broader community engagement. So that might be working with partners such as Red Cross to engage and prepare communities in the event of a dengue outbreak, for instance. So some biopreparedness work, or it might be working with academic partners in the country who have got an interest in engaging community for community resilience. Next, thanks. Just keep going through things. So, yep. So I guess just to say that again, it doesn't need to necessarily be driven or conducted by a Ministry of Health staff member, but needs to be done in partnership with. Next, please. So just to summarise, the small grant scheme has been expanded and much more flexible. Same with the citizen science work. So it's not necessarily citizen science, it's now going to be around community engagement. Opportunities to work across your in-country partners and others, so much more flexible, and that there'll be a call for operational research projects towards the end of this year, likely around October, November this year for funding. But please reach out in the meantime if you've got ideas and want to get involved or want to address some operational challenges. Thanks.